Certainly, yes. I completely agree with you that transgender surgery represents how the new paradigm of medicine. In the past, medicine used to represent only something to try to make people live longer, while now we are trying to focus more on the quality of life. And in other words, while before medicine had the aim to add years to life, now the aim of medicine is to add life to years, so to improve the quality of life. And this is a typical example of gender patients. Gender patients, from a health point of view, they are perfectly healthy. They have a perfectly healthy cardiovascular system, and all their function are preserved. Obviously, there are people who are not happy with their own gender, and they feel as if they are entrapped in the wrong body. And that's why medicine has had multiple efforts to try to reassign them. My experience is limited to female to male transsexuals, but I presume that the same conclusion could be drawn even the other way around in male to female transsexuals. With regards to female to male, there has been a significant challenge to try to, from a technical point of view, in order to recreate the best cosmetically and functionally phallus. And there have been various techniques over the years that have been advocated to do so. Obviously, an ideal phalloplasty, which is an ideal penis, neopenis, would involve the creation of a penis of good cosmesis, which resembles a real penis, which has an incorporated urethra to allow the patient to be able to avoid standing from the tip of the phallus, because this is one of their main aims in life from the transformation, and which has enough bulk to allow the insertion of a penile prosthesis to guarantee the rigidity for sex. Certainly, it would be very important for the phallus to have a tactile and erogenous sensation for the patient to be able to climax. And also, ideally, the procedure should be associated with minimal scarring in the area where the tissue has been harvested to form the phallus. And there has been various techniques over the years, since the 1940s, when the first phalloplasty has been described in the literature, until now, where we are actually very can you stop 1 second?
We can edit it as well. So we can
okay, okay, perfect. Until now, where there is a very strong consensus that the forearm free flap phalloplasty guarantees the best cosmetic and functional results. This procedure involves harvesting the tissue from the non-dominant forearm, and this will leave a scar, which is the only main drawback of the procedure. But this will allow the formation of a phallus, which is a good cosmesis, who has sensation, and which allows the incorporation of a new urethra to allow the patient to avoid standing in a male urinal, and will allow the insertion of a penile implant for rigidity. So there have been a significant improvement, and with regards to my practice, my main experience is with this kind of phalloplasty, and I am not keen to go back to any previous techniques, because this one guarantees better results. Most of these patients always wanted to go ahead with reassignment surgery. Before this was not available, there were more limited surgical choices for the reconstruction. Look at him. Certainly from the beginning of my practice, patients were keen to undergo reassignment surgery. But the main issue is that at the time the surgical options were more limited. We had just started doing the forearm free flap phalloplasty, and the main experience was with Gillis flaps and infraumbilical flaps, which were associated with much poorer results. And also the availability of surgical space in theater was more limited, so patients had to be put on longer waiting list. Now patients are able to be treated much quicker, and they have a much wider options from surgical techniques and type of phalloplasty they can choose. Maybe I would like to start from the last part of your question. Certainly, it's very important for the surgeon to see that his own patients are happy, and that will also push the patient to strive for the best. The surgeon will push the surgeon to strive for the best and to try to further improve his what he is offering in all his clinical activity. With regards to gender patients, female to male transsexual, certainly if the patient has not had any complication, which happens in most cases, then they will be able to avoid standing, they will be able to have penetrative intercourse, so most of them will be very happy and they will be very grateful to the surgeon. Obviously, it's a complex operation which is done only in very selected high volume centers. So there are some complications. Around 1 or 2% of patients may lose the phallus, but almost everybody else after revision surgery will be able to avoid standing from the tip of the phallus and eventually will be able to have an erection to engage in penetrative sex. So the vast majority of patients will be happy and will be grateful to the surgeon. First of all, there will be some patients who now undergo penile prosthesis, which in the future may not need to undergo penile prosthesis because we have other medical treatment like shockwave, which may downgrade the degree of erectile dysfunction. So some patients that now may not respond to oral treatments, they then be able to postpone penile prosthesis implantation to later on in life. With regards to penile prosthesis, there is continuous development and all penile prosthesis companies are working closely to surgeons to try to improve both the implant in terms of shape, user friendliness and reliability from a mechanical point of view. So I'm sure the main aim towards which companies and surgeons will try to work to is to try to further reduce infection rate, which, as we know, is the most worrying complication because it will require the implant to be removed from the patient. Already there have been significant improvement, like in the antibiotic impregnation or the hydrophilic coating, but I'm sure there will be some further improvement from that perspective. We are working on reliability because we know that eventually the penile implant will undergo mechanical failure. As I usually tend to tell patients now, implants we remove now have been implanted usually 10-15 years ago, but I'm sure the implants we implant now are more reliable than the implants that were implanted 10-15 years ago. So I would expect the implant to last longer. And I'm sure that in 10 years' time, we will have superior implants. The aim is to try to work on, also from a patient perspective, to try to make the pump more easily to access to the patient and more easily to cycle. And also another factor is to try to be able to make the implant even more discreet than now, especially during flaccidity. We in medicine have to see our discipline as something fluid and dynamic that needs to change. We need to realize that there will be always progress, there will be always something to learn, there will be always something to improve. And so my aim in the future is to continue in my field of interest, which is andrology and complex urogenital reconstruction, to try to increase my experience by increasing the volume of operations, to continue increasing my international profile by publishing more papers and being part of more international societies and getting invited to more international society to publish. I would like in the next 5 to 10 years to get more international recognition and be more established. The new trend in medicine is to try to focus mainly on quality of life of patients and patient satisfaction. So ultimately we want to try to improve techniques, we want to improve our skills, we want to keep updated and keep on interacting and collaborating with other leading experts in order to try to improve surgical devices and techniques. Because ultimately what we want is to try to improve surgical outcomes, to improve quality of life and patient satisfaction. The first experience I had was when I was still in Italy, and I had this patient who was a female to male transsexual. Obviously, after the patient had surgery, after he woke up, I went to his bed. He was still the anesthetic had just worn off, and I discussed with him the outcome of surgery, and I showed him his phallus. The patient started crying for happiness and said that he had been waiting all his life to be able to have a penis, as he was not feeling that he was born in the right body, and he was born in the wrong body and with the wrong gender. And he was shaking my hand and crying for happiness. And obviously this gave me an incredible satisfaction, because seeing a patient who is happy, and the fact that seeing that I've been able to have such an impact on the life of another individual is something that gives us incredible strength and gives us the determination to work harder, study harder, and do the best.